I mean, I think that most people who would see you and your title would say, "Oh, well, she's a Western trained medical doctor, and practices it, and that this will be, will formalize how you feel you can treat people." But I have a question about whether you can speak to, in the places that you've practiced, so Lebanon and the US, whether there is a difference in which you practice. Do you practice differently depending on the culture in which you're in? Or do you feel that Western clinical medicine is in that square that you described, and that you just consistently practice irrespective of where you are?
Yeah, great question. So definitely the way I practice is different geographically. So between Lebanon to the US to I'm also licensed in Mexico and worked clinically in Mexico for some time. And the type of care I provide, or the type of medical attention I provide as a family physician, is different depending on the geographical context. Um, but more so than just the geographical context, I think there's also a temporal change in the type of practice I have. So being a fresh graduate versus a year out, 2 years out, and now close to 10 years out of medical school, uh, the the type of care you provide and the way medicine is changing as well, right? But when I graduated medical school, the amount of information you had to search through to get to an answer to help guide your diagnosis and management of a patient was not nearly as vast and wide, and the resources that we have now as clinicians, and the fact that so much is dictated by your computer, by what you have in front of you, by how much you have to document, by the administrative processes that have been added over the past decade to medical work, and how much then that takes away from the touch aspect and your presence. Sometimes touch for me is, yes, there's the physical exam part, but there's also the eye connection and the sitting there and speaking to patients that that when we were trained on. That was when computers were sort of a thing already, but still we had enough time to still be told that, finish your notes on the side, but make sure you have time for your patient. And now it's impossible to teach medical students and residents to just give all their attention to patients, because attention has become so rare, so scarce. And that in that attention, that process of attention giving and is closely linked to touch. I think there's an aspect of touching patients just with your eyes. The type of look that you provide a patient, the type of the facial gestures you make, that's all introducing the aspects of touch that then transform a clinical experience for a patient, for it to become a fruitful one where they come out of and they feel recognized, acknowledged, appreciated, and are motivated to manage their condition, or if they leave your office feeling misunderstood, unheard, and that. So I think I started on this. I started on the journey of being a medical doctor, having had so much more time, and over the years, your time crunches as a medical doctor, that your visits have to become faster. You have to fill in all this paperwork, and so with time, I've noticed a change in how I provide care. But luckily for me, I think the skills that I learned as an anthropologist have tremendously helped me to be able to sit with the patient, even if it's for a shorter time, and yet be able to get to that click that has to happen to make them feel heard, to have that connection that then I think supports the touch medicine aspect of it. But to go back to the geographic aspect, because language is so important to uh, people feeling understood. I think initially when I was in Mexico and started seeing Spanish speaking patients when my Spanish was not so great. Well, actually, I started seeing Spanish speaking patients in the United States, and I didn't speak Spanish at the time. And I could see how different things were after I picked up the language and was able to attend to patients in their native language, and how much that helps in just facilitating the process of care. And so then going back to Lebanon after training and working in the United States, and seeing how in my mother tongue and in my own culture, how much more powerful as well a clinical visit can be when it's in a culture that you completely understand and are part of and can easily connect with people, was also something eye-opening for me in terms of how I can provide care, where I can make the most difference, but also challenging because you understand too much of a certain situation that also burdens you more as a care provider, knowing the intimate details of what a patient's suffering is coming from, especially in the realm of mental health conditions, I'd say.